Hello and welcome to Talking General Practice, the podcast from GP Online. I'm Emma Bauer, the editor of GP Online. Coming up on the podcast today, I'm joined by our deputy editor Nick Bostock to talk about the latest news affecting general practice. This week we'll be talking about the results of the BMA's referendum on the GP contract for England for 2024-25 and what happens next. We'll also be looking at whether GPs will be prepared to take industrial action and the types of action they might consider later this year based on results from our own polling of the profession. We're also discussing whether general practice in England is shifting to a GP-lite model as many GPs struggle to find work at the same time as more than £1 billion of funding a year is pumped into the additional roles reimbursement scheme. And we'll be looking at the results from the latest British Social Attitudes Survey about what the public thinks about the NHS. Our good news story this week is about the rollout of life-changing technology for patients with type 1 diabetes. That's all to come on this episode of Talking General Practice. First up, let's talk about the BMA's referendum on the GP contract for 2024-25 in England, which has been imposed on the profession this week. Nick, the results were published last week. It was a pretty overwhelming rejection of the deal, wasn't it?
It was. A poll we ran the week before suggested that nearly all GPs would vote to reject the contract, and that was very much how it turned out. To remind people that the referendum asked GPs to respond to one question only, which was, do you accept the 2024-25 GMS contract for general practice from government and NHS England? And more than 19,000 GPs and GP registrars voted, which the BMA said was a turnout of 61.2%, and 99.2% of people who voted to reject the contract. The word you used just now was overwhelming, and I think that's it's pretty fair to say that about covers it.
What has the BMA said about this? I mean, the vote doesn't necessarily change anything, so what's the BMA hoping it will achieve?
In terms of the significance of the vote, the BMA said the near unanimous decision against the contract shows just how deep anger and frustration runs within the profession at the moment. The head of the BMA England GP committee said that in her 20 years as a GP, she'd never known the profession so frustrated, angry and upset. And she said general practice has been put in a position where doctors just can't offer their patients the services that they want and need. The contract for 2024-25 is the third in a row that's been imposed on general practice, meaning it's a package of changes and funding that's not been agreed between the government and the BMA. So instead of an agreement, GPs have just been told by the government, this is what you're getting. The contract imposed for the year ahead brings an uplift worth around 1.9%, as we've discussed previously. The BMA says that falls so far short of meeting practices' rising costs that it'll drive some practices out of business, while others are forced to try to absorb the hit by taking measures such as reducing partners' income or cutting staff and services, for example. As you said, that the vote itself doesn't change anything. It doesn't stop this contract being imposed. But the BMA says this is the start of a fight back by general practice. For one thing, it sends a really clear signal to the government about just how deeply opposed the profession is to the contract that has been imposed on them. But ultimately, this is also the first step on a road that looks increasingly likely to lead to industrial action by GPs.
So do we know what happens now then?
First of all, the imposed contract takes effect from the start of April. That's now in place. The miserly funding uplift it comes with could yet be revisited later this year once recommendations from the DDRB, the independent body that advises the government on doctors' pay, are made public over the summer. Those recommendations are likely to come around July. The government has said it could change funding to reflect whatever that advice is, and it seems likely the DDRB will recommend something more than the 1.9% uplift the government has put forward so far. The government won't necessarily accept any recommendations in full, but whatever comes from the DDRB could have a bearing on events later in the year. There could be a further round of negotiations between the BMA, the government and NHS England, for example, over any further injection of funding through the GP contract. In the meantime, the BMA is planning roadshows to talk to GPs across the country about the contract and potential forms of industrial action. And it's also planning to publish a document setting out its vision for general practice. A ballot on industrial action could potentially open from September this year, according to BMA. An action could go ahead if GPs approve it, around the time of a general election towards the end of the year. I think it's worth mentioning here that when we talk about industrial action in general practice, we aren't talking about full walkouts or strikes. The action won't be anything like the sort of measures we've seen over the past year or so in hospitals. I think the success of any ballot of GPs over industrial action is going to hinge on how well the BMA can convey that to GPs, and also the types of action it proposes, which you're going to talk about shortly. And then, obviously, whether anything seismic comes from the DDRB that really shifts the dial on funding.
Yeah, so on industrial action, like you say, I mean, we should really stress that the BMA has already said, in fact, actually, that any industrial action GPs are balloted on would aim to target NHS England and the government and not patients. I mean, you mentioned that timetable there, that we're potentially looking for some sort of ballot from September. And the other thing the BMA has said is that any action would be timed probably from sort of late November into early December. So the big question is, would GPs actually take industrial action? And if so, what forms of action would they take? So we've actually got the results from our own survey that we conducted over the past month, which found that almost 3/4 of GPs said they would support industrial action. That poll of 391 GPs found that 72% said they would be prepared to take part in industrial action. We also asked them what had led them to support taking action, and over 80% said it was because of the stress and burnout GPs were experiencing. The same number said it was because of pay and underfunding, and a similar number said it was because of high level of workloads or because of concerns about patient safety. So, some very real reasons why GPs feel they've reached this position. We've talked on the podcast before, I think, about the types of action that the BMA has suggested could potentially be on the ballot. So we asked GPs in our poll which of those they were most likely to back. And of those GPs who supported industrial action, the overwhelming majority, this was 84% of those GPs who backed industrial action, said they would support adopting BMA safe working advice, which would include limiting the number of appointments a GP saw in a day to 25. Behind that, the next most popular sort of options were 60% backed partial or complete list closures, and over half also supported handing in notice on shared care agreements and stopping what the BMA describes as rationing, which is basically where GPs are holding on to a lot of risk by managing patients in general practice as opposed to referring them into other services. There's a few other things as well that smaller numbers of GPs supported, and you can see the full breakdown of the results from that survey on our website. But one thing that was really interesting is looking at the responses from GPs to that survey. I think you're right, Nick, that how the BMA conveys what industrial action would mean for GPs will be really crucial to the success of any future ballot. There was a lot of concern about the prospect of taking industrial action and how that might impact on patients, and also whether patients would actually support GPs taking industrial action. Quite a few people raised concerns about that. And I'm sure that the BMA is very aware that patient support will be absolutely crucial if any industrial action that GPs do take is to succeed. But I think the general feeling from the poll was that things are now so bad in general practice and underfunding is such a cause for concern that really many GPs felt there was little option left other than take industrial action to take that step. I think the BMA is aware, though, of some of these concerns around patients. We know we're already planning roadshows, which you mentioned in the summer. And I think the intention there is for the GP committee to get out there and really meet grassroots GPs, talk to them about industrial action, what that might look like, and get feedback from doctors about steps they are most likely to support. And I think a big part of those roadshows will be about the BMA trying to explain how the profession can do this without causing problems for patients. And obviously the feedback the BMA gets from those roadshows will undoubtedly feed into any ballot we see in the future. Next up, we've talked a lot in recent weeks on the podcast about the struggles GPs are facing finding work. This is because of the financial challenges practices are currently facing because of several years of below inflation funding increases, a situation that's unlikely to improve given the current contract that we've just been talking about. At the same time, £1.4 billion a year is now earmarked for the Additional Roles Reimbursement Scheme, which provides funding for primary care networks to pay for staff in other roles, including clinical pharmacists, physicians associates, care coordinators, physiotherapists, and a host of other posts. So what does all this mean for the future of general practice? Nick, you've been looking at some of the appointment data, which provides breakdowns of who is delivering appointments in general practice. What does that tell us about all of this?
A little while ago, the BMA sessional GP committee warned about the emergence of what it called a worrying new model of NHS general practice delivery. And what it was talking about was a shift towards a smaller share of appointments in general practice being delivered by GPs and more being delivered by other staff. And it's also been referred to as a primary care light model. I'll come on in a minute to talk about the scale of that shift, but this is very much tied to the points you've mentioned around underfunding of general practice, which has left practices struggling to afford to recruit GPs, and therefore, as we've talked about previously, GPs struggling to find work. And it's also linked to the ring fencing of millions and millions of pounds in funding for the recruitment of other staff in general practice through the Additional Roles Reimbursement Scheme, the ARRS. So looking at the data on appointments in general practice, and this is data that come from NHS Digital, these figures show that total appointments per year are up by around 50 million compared with 2019. So that's a big deal for the government because one of its manifesto promises at the last election was to deliver 50 million more general practice appointments. The government likes to say that it's delivered 50 million more GP appointments, which is problematic in several ways. So one, it clearly isn't the government that's delivered them. Two, celebrating a large rise in appointments, which means a large increase in pressure on practices, can seem perverse. And three, perhaps most importantly, they aren't all GP appointments. I mentioned the proportion of overall appointments by GPs had dropped. So over the 12 months to February 2024, so that's the most recent year's worth of figures available, 46% of appointments in general practice were delivered by GPs, so it's just under half. But in the year to February 2020, so that's before the COVID pandemic, it's before the ARRS had got underway, 52% of appointments in general practice were delivered by GPs. And actually, if you go back another 10 years before that and another 10 years before that, the proportions are significantly higher again. The proportion of appointments in general practice delivered by GPs has dropped by 6 percentage points in just the past 4 years. Total appointments actually delivered by GPs have risen by more than 6 million in that period. But appointments by other staff in general practice have risen much, much faster. And those account for the vast bulk of the overall increase. It's 40 million plus of those 50 million appointments. And here's why those figures capture the crisis facing general practice, particularly when you combine them with workforce data. We know that numbers of fully qualified full-time equivalent GPs fell by around 2,000 between September 2015 and September 2023. So we have fewer GPs now delivering more appointments themselves, but also supervising a GP trainee workforce that's doubled in size over that period, and now supervising a multidisciplinary team hugely inflated by 30,000 plus people brought in through the ARRS. So that's what the BMA means by primary care light, fewer GPs doing more themselves and taking responsibility for managing wider teams of other staff. The BMA said that if you took the £1.4 billion a year in ARRS funding and spent it on GPs, you could have an extra 14,000 GPs working in general practice in England. One GP said to me recently that if the NHS had chosen to spend the money on GPs, you might have seen an even greater increase in appointments because GPs can generally deliver more appointments per session than staff in other roles in primary care. That would also have meant the stories we've published recently about a GP working for Uber, GPs going to food banks because they can't find work, would be less likely to have emerged. And primarily, patients would have found it easier to get an appointment with a GP rather than another member of the practice team, and the GPs who remain in the workforce wouldn't have to spend so much additional time supervising staff who are not GPs, which is a contributor to stress and pressure that's pushing doctors out of general practice. We're going to talk shortly about the latest findings from the British Social Attitudes Survey, which is one of the barometers of satisfaction with the NHS and with general practice. And the BMA has linked this rise in appointments by non-GPs with falling satisfaction with general practice as a whole. It's worth saying here that there is definitely a value in having access to pharmacists and physios and many other staff in general practice. But the point here is that a big expansion of the multidisciplinary team and appointments by these staff shouldn't be badged as anything like an increase in GP appointments. This is something that perhaps should have happened alongside an expansion of the GP workforce and appointments by GPs, but not instead of it.
It is important, isn't it, to stress that point that working as part of an expanded multidisciplinary team in general practice does have many advantages, and it can be a big benefit for patients. But what we're talking about here really is that this massive increase in appointments in general practice, a lot of that, they're not GP appointments, and that's the point to make. You also wrote a story really recently about the NHS workforce plan, and that plan has set out details to increase the number of GPs, but it's also very much based on a big expansion of these additional roles as well. The story you wrote recently was about a report from the National Audit Office, which says that the workforce plan is really based on the substitution of GPs, which is basically what we've just been talking about there. So what did the NAO actually say?
The NAO was quite critical of the workforce plan, and in particular of what it has to say about general practice. It said the plan overall had significant weaknesses, and one of the weaknesses it plucked out was that there's an assumption that what it calls a significant change in how general practice operates can just be pushed through without any consequences. The NHS workforce plan is a 15-year roadmap for the workforce for the health service, which was published last summer. The NAO pointed out that by 2036, which is the end of that 15-year roadmap, the plan envisages only a 4% increase in the number of fully qualified GPs in England compared with now. And to put that in context, the plan also maps out a 49% increase in hospital consultants over the same period. So consultants will increase in number 12 times faster than GPs under the workforce plan. And the NAO said the plan for general practice was one of the biggest examples of what it called workforce substitution in this plan. The idea of services currently delivered by one type of health professional being delivered in future by a different type of health professional. Part of that is based on an assumption that an increased number of GP registrars can take on more work, but it also envisages doctors who are not GPs, such as staff and associate specialist doctors, taking on work in general practice. And that's something the BMA has said is not viable. And clearly all of this also harks back to what we've just been talking about, with a smaller share of appointments in general practice in future being delivered by people who are actually GPs.
Are GPs themselves concerned about this? And we talked about our survey earlier, but we did ask them about this, didn't we? What did that find?
Our latest survey shows that more than 4 in 5 GPs are concerned that GPs are being replaced by staff recruited through the additional roles reimbursement scheme. That's something the BMA has said is the case. As we've discussed, we've reported a lot on practices being unable to afford GPs and therefore GPs being out of work or unable to find as much work as they would like. Some of the comments on the survey reflect what the BMA said, that ARRS money would have been better spent as part of core general practice funding, or with flexibility to allow practices to use it to recruit GPs as well as additional roles staff. They talked about some of the points that have come out of BMA surveys too, so about the risk to patients and practices from using increasing numbers of non-GP staff to deliver consultations in general practice, and ultimately the chronic lack of investment in core GP funding at the same time as this large chunk of money has been ring-fenced for recruiting other staff is fueling a sense that this is all part of a deliberate plan by the government to undermine general practice. And ultimately, this is all feeding into the likelihood of industrial action and a real revolt against the contract imposed on general practice for the year ahead.
Before we move on, I just want to talk briefly about assisted dying. Last week, a bill that could see assisted dying legalised in Scotland was published in the Scottish Parliament. The bill is proposing that assisted dying becomes an option for terminally ill, mentally competent adults who've been a Scottish resident for at least 12 months and are registered with the Scottish GP practice. It's been put forward as a private member's bill by Lib Dem Scottish Member of Parliament Liam MacArthur. It comes as moves towards legalising assisted dying are also moving forwards on the Isle of Man and Jersey. The issue of assisted dying is obviously really emotive and there are arguments for and against, but it is really clear that public backing for some sort of change in the law for terminally ill adults has grown significantly in recent years. Some of that has obviously come to the fore in recent months by some very high-profile individuals calling for a change in the law, including Dame Esther Ranson, who has been diagnosed with stage 4 lung cancer. Anyway, in Scotland, if the law does change, it will obviously have a huge impact on GPs and other healthcare professionals. Regular listeners to Talking General Practice may know that we looked at this issue in a lot more detail last year. We produced a special documentary about whether assisted dying should be legalised that looked at the arguments more widely for and against a change in the law, as well as exactly what is being proposed in Scotland. As part of that documentary, I spoke to GPs on both sides of the debate, patients, Liam MacArthur, who's introducing that bill, and also Conservative member of Scottish Parliament and Glasgow GP, Dr Sandesh Gillane, who chaired a medical advisory group which looked at some of the healthcare-related issues linked to assisted dying as part of the process of developing that Scottish bill. I also spoke to Dr Catherine Forrest, who's a family physician in California who helps patients there have an assisted death, and whose husband chose an assisted death in 2021, which she speaks really movingly about. So for anyone who is interested in the issue of assisted dying, what it could mean for GPs if it were legalised, and also would like more details on what's proposed in Scotland, including some of the safeguards that would be in place, please do have a listen to that. We'll put a link to that episode on our website in the notes for this episode. But if you're listening on a podcast platform, you can find it if you scroll back in the feed, and it was out in March last year. Last week, the results of the annual British Social Attitudes Survey were published. The survey, which is undertaken by the King's Fund and the Nuffield Trust, made for pretty grim reading and found that public satisfaction with the NHS overall and with general practice have sunk to the lowest levels ever recorded. Nick, what exactly did the survey find?
Basically, it found that after hitting what seemed like rock bottom last year, public satisfaction with the NHS as a whole and with general practice fell again this year to yet another all-time low. When it comes to the NHS as a whole, just 24% of people are satisfied overall, according to this survey. That's the first time in 40 years that the British Social Attitudes Survey has found less than 1 in 4 people are satisfied with the NHS. The main drivers of dissatisfaction are pretty predictable. 71% of respondents pointed to long waits for GP and hospital appointments as the main reasons why they were dissatisfied. 54% cited staff shortages, and 47% pointed to government underfunding of the health service. More than 4 in 5 people now think the NHS has a major or severe funding problem, and almost half would support increased taxation to spend more on the health service. When it comes to general practice specifically, 34% of the general public were satisfied. That's actually pretty much unchanged from last year, while the overall NHS satisfaction figure dropped by a much greater amount. So it suggests that general practice has sort of stabilised. But to put this in context, before about 2014, general practice had never recorded a satisfaction score below 70% in this survey. So it's now at below half that level.
So why are people so unhappy? What are their main concerns with general practice in particular?
The main factors that came up, as I said, relate to access to GP appointments and staff shortages. So access is really a key factor. It's really interesting that satisfaction remains so low when we know that practices are delivering more appointments than ever.
Just talked about that.
The RCGP said last week that practices have just stretched a breaking point, and with a reduced GP workforce doing more and more, and that goes back to what we were talking about at the start of the podcast.
Were there any positives in there?
The support for more funding among the general public is a positive sign, as well as the survey's finding that the general public remain really strongly behind the core principles of the NHS, being free at the point of use. And I think another thing it's really worth mentioning here is that the other main barometer of satisfaction with general practice, the annual GP patient survey, shows a far greater level of satisfaction. So it found last year that patient satisfaction was around 71% overall. And that's, again, it's below the historical level, but it's obviously a lot higher than the 34% reflected in the British Social Attitudes Survey. That's something for GPs to bear in mind when it comes to understanding what patients really think about the level of service they receive from their practices.
What's everyone had to say about this? Maybe first of all, what's the RCGP and BMA said about it?
The RCGP said the survey showed that general practice has been severely neglected by years of underfunding and poor workforce planning. So that pretty much reflects what we've just been talking about. And it said that these findings just underscore the argument GPs are making that the profession needs more investment to deliver the kind of services patients want and need. And the BMA reaction, again, just underlined what we talked about earlier. It said that GP practices have been starved of resources to the point where they can no longer afford to pay willing and skilled GPs to work. The BMA said GPs know their patients are waiting too long to see their GP and are deeply frustrated about it, but that as things stand, practice funding has just been eroded so significantly that practices can't afford to recruit trained GPs who are out there and desperate to find work. The BMA has previously called this a disturbing paradox, this idea that basically GP practices are facing huge demand with these record numbers of appointments, but they're simply unable at the same time to recruit GPs who are available to work and willing to work in NHS general practice. The BMA said in the context of all of this that the 24-25 contract is an insult, and it blamed the government for just not listening to warnings from the profession about the kind of funding that's really needed to address the crisis facing general practice.
And what has NHS England and the government said about it? Did they have anything to say?
NHS England focused largely on the fact that patients support the principle of the NHS as a welcome finding from the British Social Attitude Survey. And the government, for its part, focused on the overall level of investment that it's putting into the NHS. And it said that that would reach nearly £165 billion a year by the end of the current Parliament.
Well, after that last bit, we actually do need some good news, and we've just got time for our good news story. And this week, it's about new technology for patients with type 1 diabetes. This week, NHS England announced that tens of thousands of people with type 1 diabetes across England are set to receive what is known as an artificial pancreas. This is the hybrid closed-loop system, which makes use of a continuous glucose monitor sensor and a body-worn insulin pump. The systems mean people are not required to do regular finger prick tests, inject themselves or make calculations and decisions about their insulin dose every day. These systems do it all for them. These systems are already recommended for use in Scotland, and last year NICE recommended they were also rolled out across England and Wales. At the time, NICE agreed with NHS England that the tech would be rolled out over the next 5 years, starting with children and young people, women who are pregnant and those who already have an insulin pump. And this week, NHS England announced it was providing local health systems with £2.5 million so that they can start identifying patients who could benefit. NICE has described the technology as life-changing and says it will save the NHS money in the long term by enabling patients to better manage their conditions. There are currently around 270,000 patients in England with type 1 diabetes, and around half of these will eventually be eligible for a closed-loop system. This is genuinely a really good news story that will have massive benefits to the patients who receive this technology. Well, that's it for this week. Thanks for listening, and thanks so much to Nick. If you're enjoying Talking General Practice, please do think about giving us a rating or leaving a review. It really does help us out. I'll be back next week, so please do join me then. In the meantime, you can keep up to date with all the latest news affecting general practice and access a host of other resources on our website at GPonline.com.